Good morning, okay, and 8:34. Happy Monday to you. All right, Dr. Schmerge, I don't drink a lot of soda. I drink some soda every once in a while, okay? I do. Diet Coke usually, though, is what I like to drink. I don't drink regular soda. It's not that I am against the cane sugar inside or anything like that. I just get the grit on my teeth and I don't like the feeling. I drink coffee. But bladder stones or gallstones or all this other kind of stones, this guy was drinking 3 liters of Coca-Cola a day.
Yeah.
Does that make you cringe as a medical expert, the idea of kidney stones and all that kind of stuff? Have you ever seen that or dealt with those or seen the patients with those?
Yeah, often.
It's gotta be painful,
Yeah.
right?
It really, what you put in your body really does matter. And it causes a whole host of health issues. So yes, that does make me cringe.
Dr. Michelle Schmerge of Equity Health, equityhealthcares.com, equityhealthcares.com. You've got facilities people can go to, and you provide home level concierge service. Your facility locations, where are those located at, the physical locations?
Physical locations, we have one in Denver here, just across the lake, and then we have one in Greensboro, North Carolina.
Okay.
And the bulk of our care is delivered in home. So we provide home-based primary care to aging seniors and people who are really homebound and have a lot of difficulty getting into clinics.
Now, when you say homebound, you're meaning people, they just don't leave their house.
Correct. It's a huge issue, and it happens to almost everybody as they age. So people just, for any given reason, sometimes it's a lot of chronic health issues. You can't be away from a bathroom too long. Sometimes it's mobility issues. You can't physically get yourself out and walk or drive anymore. So you're really dependent on a loved one or a caregiver to get you to a clinic, and so they stop going. And then really the only way you access healthcare is through the emergency system and into the hospital.
There's a lot of talk about mental health these days. Does that kind of social or lack thereof affect the human body, brain, us as general as people?
Yes, profoundly. It's really one of the biggest things I deal with. Is sometimes I am one of the only humans people interact with in a given month even. And so, patients will start to say, my memory is really going and I can't think about things like I used to. Will you do memory testing on me? And it turns out they're just fine. They just really haven't exercised that ability to think on your feet and talk to someone. They're usually just really consuming television all day long and not really doing all the things you need to do to keep your brain nice and healthy. And social interaction is one of the biggest things for all humans.
And in a day and age where a lot of times for the normal care people receive, and I don't like saying it in a way that makes it sound like it's bashing on the hospitals and other healthcare providers, because there's a lot of people, there's a lot to do.
Yeah.
But your team offering just that extra touch, right? That extra actual care and service in the process. When you start that journey with somebody and you walk into their house for the first time, what goes through your mind usually, or how do you process it and digest? Because I can only imagine the spectrum you've seen.
Yeah, I feel deeply grateful. You are getting to go into someone's space that they've created most of the time for many, many years. I mean, these are homes people have lived in for 40, 50, sometimes 60 years. And a whole life, so there's pictures of family on the wall, and there's everybody's largely the same. So, we are all more alike than different. And everybody has kind of the same things you're interested in, whether it be like old time cars or families and weddings, and all the things are kind of up there for display. And it's just a beautiful thing. I take, I'm super grateful for that experience and to get to see everybody where they live. And make sure that we are, as a healthcare provider and as a nurse, we get to see all the things that sometimes you hide from professionals, like you couldn't really clean up as well, or you maybe had an accident, or you don't really have enough food. And so we get to see all those things. And so it's really important that we help them.
And so when you come into somebody's home, they're homebound, meaning they're not leaving, and you don't know, whatever level of social connection they have at that point, and you start assessing and you walk through the process. You mentioned the memory stuff. So you have the ability to do this kind of deep level testing in people's homes?
Yeah. It's largely just kind of basic tests, and most of healthcare is actually pretty rudimentary and simple. We don't do lots of imaging and things. We do partner with some companies that do x-rays and ultrasounds and things like that. We can do lab work out of your home. But also, memory testing and diabetic foot testing, and just making sure people have all the things they need. And if we can kind of identify a new problem, we can help them with those things.
One of the issues you've mentioned in the past that, again, I can only imagine the stories you've seen, but because it's a sad scenario, people are prescribed a medication. It costs money, though, right? It certainly does. And a lot of people on fixed incomes or not, very little at all. What's some of that on the prescription drug side that you've seen, and how do your services kind of overlap with potentially to help folks in that realm as well, or management at least of the prescriptions?
Yeah, we have a couple of amazing nurses that help us. Lisa, Holly, Trisha, who help us figure out ways to get medications paid for. And for the first time in my career that I can really remember, we are making decisions as healthcare professionals on what medications to take based on how much you can afford your medications, and that's pretty a hard thing to see. So I'm having to sort of use my nursiness and triage what is the most important medication to stay on, and what do we maybe not need as much anymore. And so a lot of our work is around that, and so we do a ton to kind of either get with the insurers and figure out how do we get those medications paid for, or sometimes need-based situations. But we do our best to get patients what they need, and I will say we do a really phenomenal job of that.
You mentioned diabetes too. That's a pretty intricate process, right? As far as the insulin, you needed to get all the medications and just the treatments and everything else like that. What's some of that been like? Do you deal with diabetes a lot
A
around
lot.
the area?
Yeah. Yeah. Diabetes, I would say dementia or memory impairment, and heart failure or heart issues, and chronic lung disease is probably the big four that we deal with regularly. But diabetes, I will say there's some really amazing drugs out now. The GLP-1's huge fan. It's been pretty impressive to see, the kind of the advancements in diabetes management. And really, if you just, are with patients pretty regularly and you can keep track of those blood sugars, we do a pretty good job of getting that controlled. We do make sure that they get all the medications. We make sure they're using them correctly. We make sure their caregivers are trained. We do all that stuff.
And being homebound, meaning, okay, if I'm not able to leave and you're able to be in there, but let's say the service appointment, we'll call it for lack of a better word for right now, that when you come by and see somebody and then you leave, do you still stay connected to the patient even when you're not physically there having the actual appointment? Does your team offer that as well?
We do. Yeah. Patients call all the time. They know they can always get to us. There's always a live person that you can get to. So we do. We stay in contact pretty regularly throughout the month. We see patients monthly. If we need to, we'll see you more frequently, but mostly we touch base as often as we can. And then we are always available by phone. So we do a lot of touch points in between our visits as well.
You mentioned a lot of the testing and things or blood work are fairly simple, right, in a process and what it takes to accomplish those. But some things probably get complicated from time to time. So when a patient reaches that point, what do you do in the process? How do you get them connected and help them, moving forward?
Yeah, we have a lot of goals of care discussions. So what do you really want your healthcare to look like? Usually after about the age of 84, 85, most people don't really want to go to the hospital anymore. They want to be treated at home. They want to be kept comfortable. They don't want to stay in a hospital bed for a ton of time. And so we really try our best to honor their wishes and figure out how we treat them and keep them as comfortable as possible in their home. So we will usually escalate level of care. We can consult hospice if that's appropriate, if we're kind of end of life and they're within the last couple of months of life. Or we can send them to the hospital if they need it. But we usually try to avoid hospitalization at all costs. That's usually what patients fear the most.
Whenever they're homebound, but mobility itself inside the home and you walk in, are there things that maybe there's someone sitting at home right now, sitting in a chair, right? And they're listening and they're saying to themselves, I get it. I'm homebound.
Yeah.
My prescription, they're checking all the boxes right now.
Yeah.
Is there some kind of technique you would say, just even some simple advice of, hey, stand up and try walking if you can, right? Or some type of thing to get the body believing it's there. Is there anything like that you could share maybe?
I would say the top three things, back to one of my original talks, I talked about like sleep, diet, and exercise. So I would say take a multivitamin. So that's going to check our diet part, right? We're probably going to be eating packaged foods that are pretty easy to make. Nutrition becomes a huge issue, and mobility, whatever that looks like. Even if you're in a bed, if we can move any of the body parts as much as possible, as often as possible, that's really huge. Engaging those core muscles. But if you can still stand, walk around. If you can get outside and walk 30 minutes of walking a day, any movement counts. It's really impressive what it can do for your brain. And then be connected somehow. I will say, I don't think social media is necessarily a connection. So actual real human interaction, engaging with someone in person is unbelievable. I think our frequencies and wavelengths to each other really matter, and everybody can feel that. And so it really does wonders for your brain. But I think those are pretty big things you could do.
Just open the window and start throwing rocks at the neighbors'
Totally.
houses. That's
Totally.
an option too. Dr. Michelle Schmerge of Equity Health, equityhealthcares.com. Get that concierge service. Have somebody come in who truly cares and wants to see you succeed and live the best life you possibly can. And so, Dr. Schmerge, thank you for your services that you offer. Thanks for coming in and sharing it with us.
Thanks for having me.
EquityHealthCares.com. Dr. Michelle Schmerge got locations in Denver and Greensboro and will come to your house, make it even easier for you.